Okay, so I'm really excited to be here with Dr. Douge, speaking about how cultural identity really implicitly impacts feeding decisions um, for cluster and by heart. Dr. Douge, thank you so much for having this conversation with me. This really started off as just a thought as it relates to my own family and doing a lot of reflection there, becoming a mother. And so I'm excited that that has now kind of blossomed into a larger conversation. And I'm really excited to hear your perspective. And I'd love for you to come on board and tell us a little bit about yourself.
For sure, and thank you. It's an honor to speak with you this evening about an important topic. So, as you introduced me, I'm Jacqueline Douge. Go by Jackie. I'm a pediatrician by training, and I practice in general pediatrics in Frederick, Maryland. And I also have some experience in public health as well. I was a maternal child health director for a local health department, and also a deputy health officer for another health department here in Maryland.
Incredible. And I love that we have this Maryland Connect. I'm actually originally from DC. All of my family, yes, all of my family lives in DC and Maryland, between like Montgomery and Howard County. So it feels like home talking to you. So I'm looking forward to it. I myself am a visual artist, and I also host a podcast and community platform, Cool Moms, which really highlights women who prioritize both themselves, their passions, along with motherhood, which, as we know, is no easy feat, all of those things being full-time commitments. So that is what I do. And so I'm particularly excited to have this conversation because it really came about as I was considering my own feeding choices. I breastfed. I have a 3.5-year-old, and I breastfed my son for about 15 months. And that choice really came from being informed from my mother, who also breastfed my siblings, but did not breastfeed me. And as I became pregnant and was working through that entire experience, of course, a lot of questions came up, and she told me that, the reason why she didn't breastfeed me, being a much younger mom, is because for her mother and her mother's generation, breastfeeding was something that was really synonymous with being poor. And that was the only choice that was had, as formula was really expensive. And this was during let's say with the 1940s in rural New Jersey. And so again, there wasn't a lot of education or access to information around breast and body feeding versus formula. In fact, what I found out as my family came in town is that it wasn't even formula that was what they fed children. They actually fed them canned milk and would water it down with water because, again, formula was really expensive. In comparison. So that kind of led me to this bigger idea of how does our cultural identity and our experiences, whether ourselves or generationally, impact the choices we make in parenting. So I would love to kind of start off, as we're talking about cultural identity, to talk about how do you culturally identify and how does that impact your own choices centered around motherhood?
So I think those are excellent questions. So for me, I identify primarily as an African-American woman, first generation, but I also identify as biracial as well, biracial Black woman. And I think for me, we didn't talk about breastfeeding, okay, when I was younger or having my kids. And I don't even think I even thought to ask my mom about her experience until I had my first son, and that my first son now is 22, and I think culturally, I totally, after having conversations with my mom, learning about breastfeeding, the choice to breastfeed or not, and then ultimately maybe not really being, so I was in residency when I had my first son, right? So that was also like sort of a different culture as well, right? Not even racial culture, it's just the whole professional culture. And thinking about, okay, I had my first son in my second year of residency, and then just trying to balance, at the time, like 36-hour calls, right? So, and then with a new baby, new infant, like how am I going to try to breastfeed a new infant and it would just be for a short period of time. And I ultimately made the choice to use formula instead of breastfeeding. Actually, I did try to breastfeed the first week. And then again, in my head, kind of figuring out like, how am I going to do this? And I think the stress of trying to figure out how am I going to continue to do this in residency with this new, newly hatched baby. So those really influenced my decisions as well. So the culture, yes, but also there were some other, professional, pressures, I think, as well.
I think that's such an important point to bring up, because culturally, I think it's the thought is, of course, race and ethnic background is a huge impact on how we culturally identify. But you're absolutely right in terms of our profession and the communities in which we align with have a huge impact. And I wanted to kind of share this little tidbit because this was affirmation for me today. I had a real life experience. I went to go get my eyelashes done. And I was in the shop, and when you're getting your eyelashes done, obviously your eyes are closed the majority of the time. It's like a 2-hour process, very involved. There were 2 other Black women that were in this shop, which was the first time that I've been there, and there have been other Black women present. And the conversations they were having were centered around feeding. And which I kind of blew my mind because I find that to be very specific, especially as it relates to the scope in which we're talking about feeding, which is cultural identity. And she spoke about how the community in which she was part of was a community of mothers that had premature children. So her daughter was born prematurely, which meant that because the child was in the NICU, she couldn't always breastfeed. She couldn't always be at the hospital. And also her daughter, it took so much energy for her to be able to feed from her mother's body that she would be exhausted and sleep for much longer, but still not be fully nourished. So she had to make the choice then, because of circumstance, to formula feed. And so I was really happy to kind of like have that engagement with this woman in real time and in a space in which we felt comfortable talking to one another. Like there was a certain undertone of being similar types of women that both like to get lashes done in this space where typically I don't come across other Black women in this particular facility. And so it made me feel so much more comfortable having that conversation and both of us being seen in that. And so it led me to believe, well, where are we getting our information from? Where are we having these conversations centered around how we approach mothering, and then how we identify and where those intersect? And I'm wondering, was there a space in which you felt safe as you were ushered into motherhood where you could identify and talk about?
No, I think I did, I do have close friends. But again, at that time that I had my son, I was like one of the only residents right at the time that made the choice to have kids that early, right? Most people are waiting, that's kind of difficult. I mean, it's difficult anyway to have kids, right? But then to have it, and it's like you're basically not there, right? So my husband is basically taking care of the baby, or family's taking care of the baby while I'm trying to become a doctor. So it was a little bit harder. It was a little bit harder for me in terms of having that support. But I think I love the points that you bring up, because I think my role as not only as a professional provider, right, a clinical provider, but also a public health doctor, is really thinking about ways that we facilitate those conversations, right? How can we help engage moms into groups that will help facilitate and provide that peer support? And I think that's an area that I think is lacking. And I think that's an important piece to bring up, especially when you talk with your providers. Now, for me now, the parenting journey is different, right? So I'm on the other side of it now, where I see moms, and I'm serving moms, right, who have just had newborns, and then you're seeing them in the nursery about what their feeding decisions are, and trying my best, right, to kind of think back about my experience and using that experience to now inform how I support, how I show up for moms, so that I can support the choices that they make.
Yes. And have you ever found specifically in your profession supporting mothers that someone's own like cultural background or where they're informed from has specifically informed decisions around feeding, formula, or even just in general how they plan to raise their child?
I think definitely yes. But I'm happy to say that most of the moms that I'm seeing in the nursery, or not in the nursery, because they're babies and moms are like are cohorted together, right? So when I see the babies in the hospital with their moms, many moms are already making the choice to breastfeed, which I'm thinking like years back, I don't know if that necessarily would be the case. So I think the word is getting out about the importance of breastfeeding, and then there's certain circumstances where mom has tried and there are complications, or there's just something that happened, right, and they've had to make the choice to use formula. But I think many women that I'm finding are going in with the idea that I would more times than not that they want to at least try to breastfeed as much as possible, and then just trying to find ways to support moms in whatever decision that they make.
Absolutely. And I think, as you were speaking, it also made me think of, I could imagine during times like, for example, the 80s, when there was a huge surge of women going to work, returning to work, joining the workforce, where we see a spike in formula numbers, because now it's this idea of a balance, so to speak, or how do we balance career and motherhood. And I think right now we're very much living in a time where now millennials, especially, who are probably the generation up until Gen Z that have had the most access to information, who also are now having children, feeling like everything has to be as close to natural or nature as possible, which as a millennial parent, I will say that it can, those kind of rigid parameters put a lot of judgment, as a millennial parent, versus in my own research that I've done, working with parents and mothers specifically, that I found doesn't exist within Gen Z, where they're much more open and just happy to do what they feel like is best for baby and their family. And I think millennials have a very specific idea of what good parenting and good choices, especially around feeding, look like. So just kind of like a thought that came into my head, and that made me laugh. Also, my mom kind of made a joke today talking about my my son's tutor and I were talking about his tantrums and having this kind of like robust conversation around where we thought he was at developmentally. And she was like, my God, in my generation, there was never this much dialogue around why the kid is having a tantrum. So I'm curious, with that said, was there a pivotal moment in your motherhood where maybe you better understood why the generations before you made the decisions that they made?
Oh, most definitely. I mean, I think again, there's the intellectual side of it, right? Because you do the study, right? You can look at all the research about why there's been such a disparity in Black women either starting breastfeeding or even continuing breastfeeding. And then in the work that I have done with public health, in terms of maternal child health, working with women who participated in the WIC program. And again, there are disparities there as well. So I mean, you kind of see it across the board. So, and even thinking for myself at the time when I thought about the choice not to breastfeed, I'm like, well, I didn't necessarily put two and two together, right? This historical relationship to choices made or not made until I was older, right? And it's like, okay, so I can probably understand why my mom made the choice not to breastfeed. And then to kind of think about, would she even remember or be able to ask her mom,
Right.
from her childhood if she was breastfed. And I have to ask her now, if she would even remember if she had
Right.
those conversations. But what I think, but what I think is so important is that there is a tide, right? The tide is changing. And I think the more we become informed, the more we can have our sister circles, right? And have peer groups where we feel supported in the choices that we're making. And also the re-education of the medical field to how do we, so that we can better support choices, because that's the thing, right? The choice to breastfeed or not, I think culturally for Black women is not just a quote unquote black and white decision, right? To breastfeed or not, right? There is this historical context,
right,
for the choices, or even if we think we have the choice, right, to feed or not, right? And historically or even economically, right, there are economics that play a role, right? So what field of work are you in? Do you have the flexibility, right? You have 6 weeks of maternity leave, and then the place that you work, is there a place for you to breastfeed, right? And I know there are laws that were recently passed over the last couple of years that have made employers, right, have breast in part of the Affordable Care Act, right? So I think that was one thing that helped, providing work sites, but certain work sites, right, to allow for places for women to breastfeed. So again, we have to think about that as well. The choice to breastfeed or not is a contextual thing, right? It's a historical thing. I mean, there are a lot of different layers that influence the choice to or not. And then when you feel like you can make the choice, what that says about the progress we've made, or does it?
absolutely. Absolutely. I think, to your point, when I realized that the privilege that I had in making that decision, because again, it was a decision that couldn't be made by my grandmother, and a decision that was informed in a different way by my mother because of her grandmother, and now being 2 generations removed from that and really seeing the access that I have to make those kind of choices is really profound. So I am so grateful for your time and your energy and your thoughts. This is a conversation that I think is absolutely ongoing and is robust and incredibly layered, but I'm so grateful that we've been able to take the time to just scratch the surface a bit. So thank you so much, Dr. Douge.
Thank you. It was a pleasure speaking with you today, Elise.
Such a pleasure, mom to mom. Thank you.